Hi there everyone, welcome to this week's video where we're going to discuss medical racism and biomedical ethics. It's a well-known fact that within medicine there are what are called differential patient outcomes. In other words, you are more likely to receive better treatment depending on certain factors about your identity, race being one of them. It's a well-known and well-studied fact that within the United States that black patients generally receive worse quality of care than their white counterparts, and that this often holds to varying degrees across people of color. So today we need to investigate this fact and really ask the question of what does this differential patient outcome mean for biomedical ethics, right? What should we learn about the persistence of medical racism, and what is our obligation as biomedical ethicists to stand against this racism, or what is it our obligation to, for example, advise doctors and so on. So I wanted to start out by just saying that there's a kind of common sense view that I think is very typical within American life that I will explain in just a moment. And then there's the view that the Hoberman reading that I had us do together communicates, I think, based on a historical analysis. The common sense view says that racism is a kind of prejudice and ignorance, and that we should rightly expect that doctors who are the most responsible, trusted, educated, regulated members of society, you would expect them to be among the most progressive group on race issues, right? I think this very well describes our ordinary attitude towards doctors, which is that in America we have a trusting relationship towards doctors, and we believe that doctors generally have a capacity to be objective, to be above the prejudices and ignorance, etc., that tends to, describe, I think, racism. But Hoberman's view is meant to be an alternative to the common sense view, and ultimately a kind of challenge to the common sense view, right? On Hoberman's account, doctors are a rich and highly privileged group. I mean, we afford doctors certain privileges, including like very high income, prestige within society, right? All of this kind of stuff, right? And so doctors on this view will tend to act conservatively so as to continue to consolidate their privileged authority, right? So on Hoberman's view, you should actually expect that doctors and medical institutions are going to be racially and conservative, right? They're generally not going to push for large-scale conservative or large-scale race-based social change, right? And moreover, that Hoberman's account can explain why there are differential outcomes in medicine even today. So on the other side of the board, I have written, I think, some important points or pieces of evidence that Hoberman brings up in order to justify his view, as well as challenge our ordinary common sense view about doctors as medical authorities. The first is that in the United States, doctors and governmental agencies performed unethical experiments on Black Americans, right? The most well-known case is the Tuskegee syphilis experiments, experiments that went over the course of decades and that involved giving black men syphilis, right, to determine how it would come to affect their body. these experiments were performed without informed consent, and so it's pretty much agreed by everyone that these experiments were very, very highly unethical. And I think it's reflective of a general approach that is part of the medical tradition in the United States, which is to view Black Americans as research experiments rather than fully embodied medical patients, right? The Tuskegee syphilis experiments are the most well known of these sort of unethical experimentation on Black Americans, but actually this tradition of unethical medical experimentation on Black Americans goes all the way back to slavery. Many slave women, for example, were used forcefully for the development of gynecological science. So it's not, exclusive to this incident by any means. It's in fact a common trend within American medicine until very, very recently, that experiments that were considered too dangerous to perform on white subjects, medical authorities would perform on Black Americans. It should not be a surprise then that the American Medical Association also supported segregation and eugenicist propaganda. The Journal of the American Association of Medicine, or Medical Association, published many eugenicist articles. So eugenicist, eu means good, and then geneticist, genes, right? So eugenics is an approach to race-based science that was very popular in the early 20th century and beforehand, that wanted to look at how science could tell us the differences between healthy and unhealthy races. Eugenics is always racist, practically by definition, and indeed, the eugenic vision of society was an important part of both the white supremacist tradition in the United States, but also Nazism in Western Europe. So we should look quite negatively on the American Medical Association's involvement with these causes, and we should make ourselves attentive to the ways in which appeals to important texts in sexology, but also just the medical sciences quite generally, are often used to support and buttress racism, right? Moreover, to move to our third point, doctors, even nowadays, believe in what are ultimately very silly racial stereotypes that negatively affect Black patients' care. So, for example, I can't remember if it was the Hoberman article or the John Oliver segment. I think it was the John Oliver segment that we're looking at for this week, pointed out that many medical students, for example, even far along medical students, believe in the racist myth that Black people have thicker skin than white people, right? There are all sorts of racial stereotypes that go into the treatment of Black Americans, right? One is that they're not susceptible to pain or to pain to the same degree. Another is that they are more likely to be engaging in drug-seeking behavior. So if you're trying to get a prescription for a medication, that's more likely to be looked upon negatively if you are a Black patient. And generally, the findings are that statements about necessary care that are made by white patients are taken far more seriously than similar claims that are made by Black patients. Finally, I think it was a well-known problem within the American Medical Association about the poor relationship between doctors and the Black community, broadly speaking. And part of what the Hoberman article, I think, really makes clear is that, of course, one way that the American Medical Association could have approached this problem is as indicating a deficiency in their own behavior towards Black Americans, right? In other words, the AMA could reflect and realize that it was really doctors in the United States who severed their relationship to the Black community and made the Black community sometimes rightfully distrustful of doctors and the medical community. But rather than engage in this kind of self-reflective activity, the American Medical Association largely blamed Black culture for their strained relationship to Black patients. So I think that we can see from this that there's a real antagonism that exists between the mainstream American medical community and the Black American community. It is a deep rift, and it has many historical precedents, and it's a very difficult ethical problem to know where to go from here in the domain of biomedical ethics. I'm so curious to hear what it is that you think. How do you think that biomedical ethicists should deal with the problem of medical racism in the United States? Is there something, training, for example, that could make doctors better about this kind of stuff? Do we need larger scale cultural change? What do you think? I'm very excited to know, and I will see you in the next video.